Hello and welcome everybody, and I'm very pleased to introduce, also welcome back once again, Dr. Adil Sheraz. Hi,
Hi
Adil.
there. Hi, how are you?
So today we're going to look again at acne, and we're doing this in conjunction with the British Skin Foundation. And we asked people to submit some of their questions on acne. Now, we did have loads of questions, so what we've tried to do is pull together a range of questions to ask Adil. So I'll kick off, if I may, Adil, straight away. Actually,
Mhm.
sorry, perhaps we should say your credentials slightly. Who are you?
So I'm a dermatologist. I'm a consultant. I work in London at the moment, and I deal with lots of skin conditions, acne being one of my specialist interests.
Well, thank you. Right, question number one. Age and dark spots make a dirty looking face. How do you get rid of them, as I look awful and it causes embarrassment?
Okay. Well, I don't think age makes you look dirty. I think I think what they're referring to essentially may be generalized sun damage over years of just essentially being in the sun. And you don't necessarily have to be in the sun constantly. It's just being out and about. That's enough to cause general sun exposure. Now, over years and over long term of being in the sun, our skin will pigment naturally, and that's normal. And we may get areas on our face in particular which are more brown or raised or rough or scaly or crusty, which can be partly raised to the sun and partly it can just be the normal aging process. Um, if you have pigmentary changes related to the sun, we refer to those as solar lentigos, which are not worrying or concerning. There are lots of things you can do. The first step would be to avoid the sun as much as possible so they don't get darker. So use a good sun protection, sunblock, SPF of 30 or 50 ideally if you can. And then there are more active treatments that you could try. So there are anti-pigment treatments that you can apply on your skin. Some of these can be bought over the counter, but a lot of them need to be done sort of in a clinic. So you may need things like liquid nitrogen or freeze little bits and pieces off, or have them treated with lasers, or there's some sort of chemical peels you may be able to use. So most of the treatments you possibly will need a dermatologist. If you buy any sort of anti-pigment product over the counter, and there's lots of them, they will have some degree of an impact on them. Retinols, vitamin C, all these products do help in brightening the skin as well.
Okay, great. I have ice-picked pitted skin from having acne when I was younger. Is there anything I can do myself, or do I need to see a dermatologist?
Okay, so you said ice pick, did you say?
Yes, is that a term?
Correct, yeah. So acne, so it's an acne type of acne scar.
Right.
Now, acne scar, there's lots of different types of acne scars that we as dermatologists will label. There are the really sort of fine indented ones, like essentially like an ice pick as you put into your skin, and you've got little sort of dents in the skin. Then you have something called box scars, which are slightly wider, and then you have rolling scars, which are sort of more wavy and bumpy on the skin. Now, it's important to know what type of scar you have because the treatment modality will be slightly different for the various types of scars. Ice pick scars are tricky. I don't think there's anything the patient can do themselves, unfortunately. There's over-the-counter treatments will not work. Even a lot of the topical products that are prescribed by dermatologists may not work for ice pick scars. So when you're dealing with these type of scars, it's often a combination of various treatments that we may use. These could include sort of more deeper chemical sort of peels. You can use something called TCA, which is a type of acid that is applied onto the scar. Then you may want to combine that with other things like surgical removal of the scar. So you actually can sometimes cut the scars out and restitch them. And that may look or sound quite drastic and invasive. But when you have an ice pick scar, because they're so deep indented, sometimes cutting it and lifting it up is the best thing you can do. There are other modalities like laser treatment, which would then allow resurfacing of the skin. But you'll almost definitely need to see a dermatologist, and you will almost definitely require a couple of different combination of treatments depending on your skin type.
Okay. Can actin keratosis resemble acne?
Actinic okay, so actinic keratosis, first of all, so what's an actinic keratosis? It is a precancerous lesion usually seen on the face or on sun-exposed areas, so back of the hands, up the shoulders, chest area. They usually appear as small, scaly little sort of lesions, probably a couple of centimeters across usually. And if you pick them, they tend to clear, but they'll come back again.
Mhm.
They may have a red base to them. They usually don't bleed, and they're usually painless. They don't look like acne. They're very different. So if you see a dermatologist or even your GP, they should be able to differentiate between an AK, an actinic keratosis, and acne. So they're very different. And the treatments, of course, are very different. Actinic keratosis is precancerous. And if it sits around too long on the skin, there is a chance that it may turn into a cancer. So it does need to be treated. And the treatment includes freezing them, or there are some specialized creams that we use, or surgical methods. So you do need to see a dermatologist or your GP to determine what you have. They do look different. Acne is comedonal, they're spots, they're raised, they will be associated with a pore or an opening in your skin. Actinic keratosis have got nothing to do with pores or openings. So they're just on sun-exposed areas.
Okay, great. Is there a particular diet you would recommend for acne, and what is the evidence base? Also is included, can you be cured of acne with isotretinoin? Oh, I don't know how you pronounce that one.
Isotretinoin, yeah, Roaccutane, which is the brand name. Now, so diet and acne is a really good question. We get that asked all the time in our clinic. It's one of the first things patients will ask, particularly with acne. Is there something I'm eating, or can I change my diet? Will my acne get better if I cut out X, Y, Z? So the studies with regards to acne have been going on for many, many, many years with regards to diet and acne. Right from 50s onwards, there's been lots of research, lots of studies that have been done. There's been no real definitive evidence, and there's lots of studies out there. Initially, there was a thought that maybe milk caused acne, and then there was just dairy products, and then it was maybe chocolate and maybe sweet, sugary foods. We're not entirely sure is the answer, but there is some research to suggest that foods that are higher on the glycemic index. Now, if you type in glycemic index in Google, you'll get a list of foods, and that essentially refers to specific types of foods that will release sugar into your blood very quickly. You get a quick surge of sugar into the blood. When you get a quick surge of sugar in your blood, you release certain hormones. One of them is called IGF, insulin-like growth factor. And we know that these hormones have an impact on the oil glands. And the oil gland is basically what is one of the main factors of why you will develop spots or acne, particularly on the face. So if you are having a diet whereby you are releasing sugar into your blood very quickly, there's a chance you may have breakouts. Saying that, a lot of my patients will give up certain food products. They'll stop the dairy, or they'll stop sort of sugary donuts and things like that, but they'll still have acne. So it may have a bit of an impact, but unless you've got very mild acne, you're not going to cure it just by changing your diet. Now, we do advise, of course, have a healthy diet, and it will have some impact, but it's not going to, if you've got moderate to severe acne, it'd be very unlikely you will cure your acne just by a dietary change. You will need some sort of other intervention. Moving on to the second part of that question, which is the isotretinoin or Roaccutane, which is the more brand known as Roaccutane more in the general media. Accutane is another word often used for the same drug. So Roaccutane or isotretinoin is by far the best chance you'll ever get of curing the acne. And yes, it can cure your acne. I've seen it plenty of times before. I use it very often. It does come with a lot of side effects, but if you're monitored carefully, by a dermatologist, so it has to be prescribed by a dermatologist. Most people are absolutely fine on it. And when you do mention Roaccutane, you get a lot of people who are concerned about the drug. There are potential side effects with low mood, depression, suicidal ideation. There's no strong evidence to back any of that up, and there's been lots of studies that have looked into it. But it is a strong drug, and we do monitor you very carefully. So it's not something we just hand out like sweets. You know, it's something we are careful about. We monitor you. We only give it if we feel it is necessary.
Okay. Right. I recently started to have many acne spots on my body, mostly face and underarms. I've never had acne as a teenager or when younger, so it is, quote, strange for me to have it all of a sudden and a lot. I also put on a lot of weight recently without changing my life or eating habits. Could that be connected in some way? I put on nearly 10 kilograms in a few months. What could be the reason for this all? Well, I think it's quite hard for you to know about the weight. We're not here to talk about the weight, but obviously to talk about the side effect of acne.
So we don't know if it's a male or female, do we, from the
No.
question? No. All right. So that would make a difference. Now, so the weight gain may be important here, because women, for example, who have polycystic ovaries will often put on weight because of hormonal imbalance, and the change in hormones will then potentially also cause acne. So there may be a relevance here. So I don't know the gender of the person. It's difficult to comment on that. So if you have just put on weight suddenly and you're not sure why, you should probably have a discussion with your GP. And one thing you might want to check is, one, your thyroid function, which can cause weight gain. Number two, whether there's a disruption in your menstrual cycle, and whether you have polycystic ovaries, which can be linked to weight gain, excessive hair on the face, and also acne breakouts. So I guess that's one thing to consider. The other thing you may want to consider is acne in the armpits tends to point towards a slightly different condition known as hidradenitis suppurativa. Hidradenitis suppurativa is a condition whereby you get acne-like lesions or boils, almost like abscesses, within the armpits, sometimes in the groin, if you're a woman, under the breasts, and it can be associated with weight gain. It results in painful lumps and nodules under the arms, and then when it heals, it tends to leave scars. So if you do have lots of lumps and bumps under your armpits or in your groin that are painful, oozing, they smell, they discharge and leave scars, you may have this other variant of acne called hidradenitis suppurativa, and you will need a slightly different modality of treatment. So you'll need to see your GP or your dermatologist. Now, hidradenitis suppurativa, or HS, is often misdiagnosed. Patients live with it far too long before they seek help, one, partly because it's embarrassing, but also partly because they're not really sure what this is, and they just put it down to, oh, maybe it's just spots and I'm breaking out, and they just leave it. And also partly because it's not really recognized that well by GPs, because it is a slightly more specialist diagnosis. And we find that when patients come to our clinics with this condition, they've already scarred significantly, and they've been waiting many, many years, 4 to 5 years almost, living with the condition, and then they come to our clinics, by which time it is a little bit late for us to help with the scars. And had they come earlier, we could have made certain interventions. So if you are getting spots in your axilla or your armpits with acne, see your GP. And if you're not sure what the diagnosis is, have a referral to dermatologist.
Oh, that's really interesting. And it's funny, isn't it? You said about being embarrassed. I just think with a lot of conditions, we say we're far more open, and we are with many subjects, but people are not only embarrassed, they also feel ashamed. And it's the shame bit, I think, is just really sad, which prevents them from seeking medical attention.
Absolutely, you're right. So we, particularly with this condition, HS condition, this is extremely embarrassing. Patients do feel ashamed of the condition. The condition itself, when it discharges, it can be really malodorous. It can smell. Patients often end up sort of almost hibernating and staying away from social gatherings or staying indoors. And they just tend to live with it, not realizing, one, there's something they can do. And there's definitely things that we can do to help, but they just need to obviously seek attention, get some help, and that's easier said than done, I understand. But we are here and we treat these conditions regularly. There's nothing to be embarrassed about. Whatever you have, we've seen a lot worse, almost definitely.
Yes, and in fact, we'll go on to one of the next question. Well, actually, no, we've got one here. Can it be done to get rid of, or minimize red thread veins on the face? Are those connected to acne at all, or are they just something separate?
Usually not connected to acne.
Right.
It can be, of course, redness on the face can be associated with acne, but if they're talking about veins on the face, then the condition that it's more likely to be connected with is rosacea. So rosacea is a condition that is often, it can be confused with acne occasionally, because you will also get bumps on your face. The slight difference is that rosacea tends to be a little bit more sore or painful. acne can be painful if you particularly have nodular cystic, but it can also be painless as well. So rosacea tends to be a little bit more painful. Patients will describe a stinging or a burning sensation. It will usually be in the central face and the nose. There will be specific triggers to it. So, for example, the sun will almost always make it worse. Alcohol may make it worse. Hot showers or exercising may make it worse. Caffeine may make it worse. So there will be specific triggers to the rosacea. It will result in redness in the cheeks, and some people will get spots like acne, but they're not comedonal, which means that they're not associated with the pore or the openings in the skin. So if you have rosacea, you're more likely to have broken blood vessels on the face. Now, the first treatment would be to avoid all your triggers, and that is hard to work out. So the best way I advise patients, what I advise them to do is to keep a diary. When you have a flare-up, write down what you've eaten, what you've done, exercise, have you been out in the sun? So write down what they did on that day. You keep a diary for a couple of months, you will find common factors, and then you'll be able to avoid those particular factors, and that will make your rosacea or your redness better. That's number one. Second is avoid the sun if you can, and use a good sun protection, high SPF factor. And the third would be seek medical help. Number one, if you have bumps, you need some form of oral or a cream treatment. If it's just the redness you're bothered about, then there are some creams that you will help, but more definitive treatment will be laser-based. So energy-based treatments, and lasers will help with the redness associated with the rosacea. And even if it's not associated with rosacea, laser will help the redness.
Thank you. I'm in my early 50s and getting a number of spots which are hard to clear. I assume this is probably hormonal, but can't be sure. I'm treating it with a cream from Dr. Smith's Sam's even range and probiotic moisturizer, but I'm concerned that I'll dry my skin, I'm combination, and increase signs of aging. Also, the use of any all sunscreen seems to create more spots. Can I do anything better to manage it?
Okay, so early 50s, we again don't know if it's male or female.
No, but
No.
no. I was just going to say I imagine it's female because she's sort of saying about being hormonal, but that's probably not right.
Probably, but I guess okay, so let's assume it's female because we can then tailor treatment based on that. 50-year-old with spots, currently using an over-the-counter treatment. Sorry about that. Currently using an over-the-counter treatment, which doesn't seem to be, or maybe is helping, but not sure it's helping. Is that right? But sunscreens make it worse, you said?
Yeah, sunscreens are making it worse.
So I guess the first question is, what is the diagnosis here? Because we're not sure. So a 50-year-old is less likely to have acne, more likely to have rosacea. Again, as I mentioned before, they can somewhat look similar, and patients may be confusing the two. Maybe the patient generally does have acne. We do see acne later on in life, and it's not impossible. But I think the first step would be, what's the diagnosis here? Because that will determine the correct treatment. Now, if you are developing spots and you are getting worse with sunscreen, again, that tends to point towards rosacea rather than acne. First, I guess the first thing you could do is if you wanted to switch your sunscreen. So often there are two types of sunscreen. There are mineral sunscreens and there are chemical sunscreens. They both work very well. The mineral ones are the ones that sort of give you the white look when you apply it. And they contain zinc oxide and titanium. So those are the basic components of a mineral sunscreen. If you are breaking out or having spots because of a sunscreen, it is likely that you are using a chemical one. So you might want to shift to a mineral one containing zinc or titanium, number one. And that will often be a lot less irritant than the other types of sunscreens. The second thing, I guess, is what's the diagnosis in your case? Have you seen your GP? Have you seen a dermatologist? Do you have acne? Do you have rosacea? Because we can't really give you the correct treatment if we don't know the diagnosis, and the treatments will be slightly different. Again, rosacea will be avoiding your triggers, avoiding the sun, using the right sunscreen. And there are some oral treatments, there are some cream-based treatments for rosacea. If it's acne and it's genuine acne, again, there are specific lots of treatments, including Roaccutane, which we discussed, that may be appropriate for you. But we really need to know what the diagnosis is. And from the question, it's not clear here which diagnosis would fit better.
But I think also, just to open it up, the fact that one just sees spots, one assumes it's acne. And as you explained, it may not be acne at all. It could be something totally different.
Correct. So if we were just going based on statistics and generalizations, a 50-year-old female with spots is more likely to be rosacea than acne. Generalization, of course, but every case is different. So it's important that we get the right diagnosis here. So see somebody to get the diagnosis.
Okay. When showering, should you soap yourself first and then wash your hair with shampoo last? I feel if I wash with shampoo first, then there's more time for shampoo on my face to aggravate my acne. That's a bit of a tongue twister, actually.
Okay, so shampoo generally will not aggravate your acne. However, shampoos will contain lots of products that may aggravate your skin generally. So you can develop eczema, itching, rashes because of shampoo on your skin. And often what happens, and you often see this around the eyes quite frequently, because when you're washing, so the eyes have lots of little crevices within them, particularly the upper eyelid in particular. So when you're washing your shampoo off, there will almost undoubtedly be some product of the shampoo left behind within your crevices, and unless you're very thorough. And people often develop a reaction around the eyes and then maybe on the face because of the shampoo. And there's various products, fragrances, for example, might cause issues. There are other stabilizers in shampoos that may cause issues. So shampoos are known to cause issues with the face. They may not necessarily cause an acne breakout. I'm not sure there's a specific link there, but they might irritate your skin, cause an eczema or a dermatitis or a rash. So yes, so if you want to shampoo, you want to make sure you thoroughly get it off. It doesn't matter whether you do it before or after. You just want to make sure it's thoroughly washed off your scalp and your face.
Fantastic. And then the last one is actually one that I pulled off our forum, and I just thought it was worth discussing. And in fact, it's very relevant to what we discussed earlier about, you know, the embarrassment and shame and how you feel about acne. I am 31 years old and have suffered from acne for over half my life. Over the years, it's ranged from moderate to very severe, and currently for the last 2 months, I've been dealing with painful, severe acne that won't go away. Right now, I don't want to leave the house or do anything. I got a prescription from the pharmacy that I'm trying to see if it will help, and I'm trying to pay more attention to my diet and what I eat. But if this doesn't help, then I'm convinced nothing will ever help my skin. Some days the pain from the acne can get so bad it makes me not want to live. At this point, I'm not specifically looking to try anything new for helping my acne, as I don't want to try too much at once, as that might cause to make it worse. But wanted to see if anyone else could relate to what I'm going through without having acne as an adult. How do others cope and maintain relationships with the people, especially when your skin hurts so bad you can't enjoy doing anything at home by yourself, let alone with family or friends? I just thought it was such a sort of, oh my goodness.
Sounds awful, doesn't it?
Yeah.
It's a sad case. Now, 31 years old and severe painful acne and a significant impact on life, relationships, self-confidence. This is quite common, unfortunately. We see a lot of this in our clinic. And it doesn't matter really, there's no real correlation with how bad the acne is either. So acne affects people differently, and some people have mild acne and, you know, it's the end of the world, and other people have severe acne and they're okay with it. So we find that actually there's no real correlation with how bad the acne is and how it makes you feel. Some people have mild acne but feel awful. So, and it's something we definitely need to take into consideration. And I often will ask my patients, you know, how does it make you feel? Are you low? Do you stay indoors? Are you preventing yourself from seeing other people? And you know, we get young patients, 15-year-old girls, for example, or even young boys who won't go to school because they've got a few spots and they're embarrassed by it. So it is very sad. And the sad thing actually here is that there's definitely things we can do. We can do to make this better. We can improve the acne. I guess the first step is seeing somebody about it. And from the question you asked, it sounded like they've seen a pharmacist maybe and have given some specific treatment, but there's no mention of a GP or a dermatologist. And I think sometimes patients may feel that there's actually nothing that can be done, which is why they might not be reaching out, or maybe they don't have faith in their physician who they're seeing. But I think if you find the right person, you will be able to get some help, and we should be able to make your acne better. Now, there was a mention of diet, I think you said.
Yeah.
Yes, diet, you're right, diet does play a bit of a role, but most people will change their diet and they will still get breakouts, as I mentioned earlier. So there are lots of medical treatments. It doesn't mean we will stick you on something aggressive right from the beginning. We will have a stepwise approach, assess your skin, see what works for you, assess your side effects that you may potentially get with the treatments, and give you the right treatment for you. But in order to do that, we need to have a thorough conversation, discuss what your needs are, what your wants are, what your concerns are, and then we will give you the right treatment. And as I said, it doesn't mean putting you on the most aggressive one right from the beginning. We can start off gently, work our way up, but we really need to see these patients and get them on treatment, and we can definitely help them. I get patients in my clinics who I do put on Roaccutane, and I can promise you almost always they've often debated, should I go on Roaccutane, should I not? They've put it off, they've waited, they're worried about the side effects. And then when I see them and they eventually start Roaccutane, 99% will say, I wish I had done this 10 years ago. Almost always that's the answer.
10 years, gosh.
Yeah, so we have people who have been with acne for years and years and years, and they put off Roaccutane because they just read online about the side effects and all the problems that go along with it. And then when eventually they come to see me and they've made up their mind, okay, fine, I'll go on Roaccutane now. And then when they've cleared their acne, they regret not going on it earlier because it wasn't as bad as they thought. Their skin is much clearer. They're more confident. They're happier. Their mood is much better, contrary to what people may think in terms of low mood depression with Roaccutane. Actually, it's the opposite, what I see, because people feel more confident. They're happier with their skin. So I think the point is, see a dermatologist or see your GP first. Get some help. There is something we can help you. There's definitely things we can do. Don't feel embarrassed. There are lots and lots and lots of people in exactly the same boat as you are. We see them all day long, and there are things we can do to make you better.
Thank you. And I think that's really reassuring. And as with all these things, it's much better to know and to get advice from that is evidence-based, that people understand it, and then you can make your own choices as to what treatment you want.
Yeah, absolutely. You just want to be able to speak with somebody who knows what they're talking about, who will give you a list of options, and then we want to be able to give you a treatment that you're happy with, and that we will guide you. We don't want to force any treatment upon you. We're here to guide you and to give you our experience with the drugs that we've treated. I've treated thousands of people with various drugs for acne. We will give you our experience, but at the end of the day, you have to take the medication. We won't give you something you don't want to take. So it's a combined mutual decision-making process.
Well, Adil, thank you so much. Thank you so much on behalf of the British Skin Foundation as well. And I'm sure that lots of people will really benefit from your really practical advice. So thank you very much indeed.
You're very welcome. Thank you so much, Katrina.